Emergency Response Committee on Coronavirus. This is our 74th day in coronavirus response and our 68th brief. Fellow Kenyans, thank you for joining us today for a daily update on the status of COVID-19 pandemic and our response to it. Today is day 74 since the first case of coronavirus was reported in our country. We have made tremendous progress and responses in combating the pandemic, and we want to reflect on some of our achievements as follows. To begin with, we are happy to note that when this campaign started, we only had 2 testing laboratories, and we are now glad to let Kenyans know that as of today, we have 20 such facilities across the country, strategically located in critical areas across the country, and with great reduced turnaround times from sample collection to receiving of results. And our plan is to continue to enhance this testing capacity across the country. Secondly, we have also trained a total of 11,000 healthcare workers, up to 60,000 community healthcare workers in collaboration with our different partners across 47 counties. And this number has enhanced our human resource capacity in our health facilities. And these trainings have featured on COVID-19 awareness, infection prevention control, and how to be able to manage COVID-19 cases. We continue to receive different resources and support from different partners. We have received support for critical care. We have ventilators coming in from our development partners, and we shall continue to ensure that we have the right capacities with regards to human resources to be able to man this equipment. We have established isolation and quarantine facilities in all the counties, and we are nearly reaching a total bed capacity of over 5,000. And we shall continue to upscale our level of preparedness to ensure that Kenyans are able to get the best healthcare services. However, as we continue to combat this pandemic, we would like to remind you that we are still not in a good place. Cases continue to be recorded, and sometimes in very large numbers, and some counties have thus been identified as high-risk counties. Numbers of infection in other counties may not be considered to be high risk, however, they are still continuing to grow, and therefore we need to enhance our alert, and this should be a concern for all of us. The containment measures that we have repeatedly mentioned, and again we shall emphasize today, include hand washing with soap, maintaining of social and physical distance, proper wearing of masks when in public spaces, and to stay at home when possible. Additional measures have been given over time, including the national curfew, cessation of movement in and out of Nairobi, Mombasa, Mandera, Kilifi, Kwale counties, restriction of movements in high cluster areas like Isili and Old Town in Mombasa. And all these measures, we are all aware, fellow Kenyans, have made life not only uncomfortable, but also difficult. However, we do maintain that these measures are necessary for us to be able to effectively deal with this pandemic. And compliance with these measures has significantly contributed to what our COVID-19 curve looks like today. The situation could be different if we had not advocated and adhered to these measures. We would like to thank Kenyans in general for their support and patriotism in observing these measures, despite the inconvenience that they have had to endure. And I would like to urge each and every one of us to continue rendering support to this fight, because that is how we shall defeat this virus. With regard to our COVID-19 situation today, our infections are yet to stabilize. Today, we have 72 individuals testing positive for the virus from 2,711 samples tested. The cumulative caseload of positives in the country therefore stands at 1,286, while a total sample of samples tested so far stand at 61,971. Of the 72 individuals, 70 of the cases are Kenyans, whereas one is of Somali nationality and the other is Ugandan. Of the positive cases, 44 are male, whereas 28 are female. The age range is between 12 years to the youngest and 78 years for the oldest. The positive cases are spread across the following counties. In Nairobi, we have 52 cases. Mombasa, 11, Kiambu, 7, Isiolo, 1, Turkana, 1. And Turkana now becomes the latest county to record a case. And this brings to total the number of counties that have reported a COVID-19 case to 29. In terms of breakdown by sub-county, in Nairobi, the cases are distributed as follows. Lang'ata has 21 cases, Dagoretti North 15, Kamukunji and Kibra 4 cases each, Embakasi East 2, Kasarani 3, Dagoretti South 1, Makadara and Mathare 1 case each. In Mombasa, 4 are from Nyali, 3 Mvita, 3 Kisauni, and 1 Changamwe. The 7 cases in Kiambu are from Limuru 2, 1 case Githunguri, Kabete, Ruiru, Thika, and Kikuyu all have 1 case. And 1 case from Isiolo has been identified, and that case is in mandatory quarantine, whereas in Turkana we have 1 case from Kakuma. Today we are happy to inform you that we've discharged another 9 patients who've recovered from the disease, bringing a total of recoveries to 402. And we continue to sincerely be indebted and to thank our healthcare workers for their continued dedication and hard work in ensuring the full recovery of these individuals. However, on a sad note, we now have a total fatality of 52. We lost 1 more patient to the disease, and we do condole with their families and friends and those who've lost their loved ones in this pandemic. During this time of COVID-19, we would like to emphasize 1 more measure that we find to be very important, and that is that of maintaining a healthy diet, because it strengthens our body's immune system to be able to fight diseases. And it's important to note specifically for individuals who may have underlying conditions or who may have issues such as malnourishment are at greater risk of various infections, including this of COVID-19. We'd also like to emphasize that it is important that we do pay great attention to what we eat. And in this regard, the Ministry of Health has developed several nutrition guidelines in response to COVID-19. And these guidelines are all available in the ministry's website. And the emphasis really, Kenyans, is to maintain a healthy diet, a balanced healthy diet, and to ensure also that you do put in place exercise. And we've noticed that these do go a long way in improving immunity and helping to fight against COVID-19. And finally, I would like to join all Africans across the continent who are celebrating Africa Day today, a day that has been set aside by the African Union to celebrate peace and prosperity in Africa. And this year's focus continues to be a joint effort through this continent to combat COVID-19. Thank you.
Keep on saying, please keep them short, so that you can give your colleagues the chance to ask.